A stroke is a sudden, life-altering event where blood flow to part of the brain is interrupted, causing damage to brain cells within minutes. The brain, our body's control center, needs a constant supply of blood to deliver oxygen and nutrients. Even a brief interruption can have serious consequences. When blood can't reach a part of the brain, that area stops working properly. This is what we call a stroke. The effects can be immediate and severe. There are two main types of stroke: ischemic, which is caused by a blocked artery and is the most common type, and hemorrhagic, which happens when a blood vessel in the brain bursts, leading to bleeding in or around the brain. Both types are medical emergencies. Fast action is critical for survival and recovery. Every minute counts. The effects of a stroke can vary widely. Some people experience weakness or numbness on one side of the body, trouble speaking or understanding words, or even memory and vision problems. Every stroke survivor's experience is unique, and recovery can look different for everyone. Recognizing stroke signs quickly can save lives. Remember the FAST test: face drooping, arm weakness, speech difficulty, and time to call emergency services. Don't wait. Immediate help is vital. Ask the person to smile. Does one side of their face droop or look uneven? Ask them to raise both arms. Does one arm drift downward or feel weak? Is their speech slurred, jumbled, or hard to understand? These are all warning signs. If you see any of these symptoms, call for help immediately. Don't hesitate. Quick response reduces the risk of long-term disability and greatly improves outcomes for stroke patients. Understanding these basics helps you support a stroke survivor and be prepared in an emergency. Patience, compassion, and awareness are key to helping someone recover and regain independence. The faster you act, the better the chances for a full and meaningful recovery. Know the signs, act fast, and always seek emergency care when stroke is suspected. Every second counts in stroke care. Time lost is brain lost. Your knowledge and quick action can make a life-changing difference for someone you love. Let's learn how to help, step by step, and be ready to make a positive impact. Daily care is the foundation of stroke recovery. Every small action you take can help your loved one regain strength and confidence, making each day a step forward in their journey. Nutrition matters. Offer soft or pureed foods if swallowing is hard, and keep meals balanced. Include a variety of fruits, vegetables, and proteins to support healing and energy. Hydration is vital. Encourage regular sips of water unless told otherwise by a doctor. Dehydration can slow recovery, so keep fluids within easy reach. Good hygiene prevents infection and boosts comfort. Help with hand washing before meals and after using the restroom. Assist with bathing and oral care, and check water temperature carefully. Gentle routines help maintain skin health and prevent irritation. Clean dentures and hands regularly. This keeps the mouth healthy and reduces the risk of infection. Safe movement is crucial. Help change positions often to prevent sores. Even small shifts can make a big difference in comfort and health. Use pillows for support and keep the environment clutter-free to avoid falls. A safe space encourages independence and confidence. Learn safe transfer techniques from a physical therapist. Practicing these skills protects both you and your loved one from injury. Always follow medical advice and give medications as prescribed. Set reminders to help keep track of doses. Keep a medication log and know what each drug is for. This helps prevent mistakes and ensures the best care. Attend regular checkups and ask questions if unsure. Open communication with healthcare providers is key. Your active involvement supports recovery. Celebrate progress no matter how small to keep spirits high. Routines maintain dignity and health. Safety first, always. Consistency helps reduce stress and confusion. Team up with healthcare providers for the best results. Share updates and concerns to adjust care as needed. Your care makes a real difference every day. Stay organized and attentive. Preparation helps you respond to changing needs. Small daily actions add up to big improvements. Encourage gentle exercises and celebrate each achievement. Be patient and flexible as needs change. Adapt routines to fit new challenges and abilities. Your support is essential for healing. With compassion and dedication, you help create a brighter future for your loved one. Recovery exercises are key to regaining function after a stroke. They help rebuild strength, coordination, and confidence, which are all essential for daily living. Physical therapy builds strength and balance, even with simple movements. Guided sessions with a therapist can help improve mobility and prevent falls, making each step safer. Occupational therapy helps relearn daily tasks like dressing or cooking. These activities restore independence and make everyday life more manageable. Speech therapy addresses communication and swallowing. Practicing speech and language skills can also boost confidence and social connection. Encourage regular practice. Consistency leads to progress. Even short daily sessions can make a big difference over time. Structure the day with a predictable routine: meals, meds, exercise, rest, and enjoyable activities. Routines help reduce stress and provide a sense of stability. Include hobbies like music or gentle gardening for mental well-being. Enjoyable activities can lift mood and motivate continued effort. Stimulate the mind with puzzles, games, or audiobooks. Mental challenges are just as important as physical ones for recovery. Use picture boards or yes/no questions if communication is tough. These tools help everyone stay connected and understood. Celebrate small victories to boost confidence. Every achievement, no matter how minor, deserves recognition. The brain can adapt. Keep challenging it. New skills and activities encourage brain growth and recovery. Make the home safe. Install grab bars, remove tripping hazards, and ensure good lighting. Safety is the foundation for progress. Clear pathways for walkers or wheelchairs. Accessibility helps maintain independence and confidence. Safety allows for more independence and practice. The right environment encourages more frequent activity. Adapt the environment as needed. Simple changes can make daily routines easier and safer. Encourage both physical and mental activity. A balanced approach supports overall recovery and well-being. Support and routine help the survivor feel secure. Family involvement and encouragement are vital for motivation. Every effort counts in recovery. Stay positive and persistent, and remember that progress is possible, one step at a time. Some actions can hinder recovery. Avoid them. Don't rush the survivor. Let them move and eat at their own pace. Rushing increases frustration and risk of accidents. Don't neglect the weaker side. Encourage its use as guided by therapists. Place objects on the weaker side to promote engagement. Don't ignore emotional changes like sadness or anxiety. Listen and seek professional help if needed. Emotional support is as vital as physical care. Don't assume their abilities. Some may understand more than they can express. Speak directly and clearly, giving time to respond. Avoid finishing sentences unless asked. Respect their intelligence and individuality. Don't talk about them as if they're not present. Patience and respect foster dignity. Avoid clutter and unsafe environments. Every action should support recovery and confidence. Your awareness prevents setbacks. Preventing another stroke is a top priority. Support quitting smoking and limit alcohol. Manage blood pressure, diabetes, and cholesterol as advised by doctors. Never skip or change medications without consulting a healthcare provider. Keep a medication schedule and discuss any concerns with the doctor. Watch for new or worsening symptoms: sudden weakness, confusion, vision changes, or severe headache. Use FAST for any new stroke signs. Act immediately. Don't let the survivor become completely inactive unless medically necessary. Encourage gentle movement to prevent clots and sores. Balance rest with activity for overall health. Stay alert for complications and act quickly. Your vigilance can save lives. Keep emergency numbers handy. Regular check-ins with healthcare providers are essential. Small changes in health can signal bigger problems. Prevention and quick response are key. Stay informed and proactive. Your attention protects their recovery. Every day is a chance to prevent setbacks. Communication challenges are common after a stroke. Use simple words and short sentences. Speak slowly and clearly. Give plenty of time for responses. Don't rush or shout. Try gestures, pointing, or drawing if speech is hard. Communication boards or electronic aids can help. Watch for nonverbal cues like facial expressions. Reduce distractions. Turn off the TV and face the person when speaking. Include them in conversations and treat them with respect. Don't talk down or treat them like a child. Frustration is normal. Acknowledge it and take breaks if needed. Celebrate small communication successes. A speech-language pathologist can offer valuable strategies. Their expertise supports progress. Every effort to connect matters. Patience and encouragement go a long way. Adapt your approach as needed. Communication is about connection, not perfection. Stroke affects emotions as much as the body. Survivors may feel sadness, anger, or anxiety. This is normal. Recognize these shifts as part of recovery, not personal failings. Watch for signs of depression, persistent sadness, loss of interest, or hopelessness. Seek medical help if you notice these signs. Depression is treatable. Anxiety and fear are common. Create a calm, predictable environment. Listen and reassure without trying to fix everything. Professional counseling can help manage anxiety. Personality changes may occur. Be patient and seek advice if needed. Support groups offer shared experiences and understanding. Remember, you're not alone in this journey. Empathy and patience are essential. Addressing emotional health aids physical recovery. Open communication builds trust. Your support is a lifeline. Caregivers must care for themselves, too. Rest, eat well, and take breaks. Your health matters. Ask for help from family, friends, or community resources. Use respite care for relief when needed. Support groups provide advice and emotional support. Share your feelings, it's healthy and helpful. Set realistic expectations and know your limits. Say no to extra commitments if overwhelmed. Protect your energy for the long haul. Stay informed about stroke recovery. Knowledge empowers you. Attend appointments and ask questions. Use available resources and workshops. Your well-being affects the care you give. Build a support network for strength. Self-care is not selfish. It's necessary. Learn continuously and adapt as needed. You are an essential part of the recovery team. Stroke recovery is a marathon. Progress takes time. Celebrate every small victory, no matter how minor. Hope fuels the journey for both survivors and caregivers. Focus on daily nutrition, hygiene, safe movement, and mental stimulation. Avoid rushing, neglect, and risky habits. Medication adherence and quick response to warning signs are vital. Respect communication and emotional needs. Caregivers, your role is invaluable. Take care of yourself too. Seek help and connect with others for support. Recovery brings challenges and moments of connection. Believe in improvement and support each other. Your dedication makes a real difference. Hope and persistence light the way forward.